Here's looking at you, DNA. I'm excited to talk ocular genetics with Naomi Wagner, she, her, who co-hosts the podcast DNA Dialogues with me. Naomi is a genetic counselor specialized in ophthalmology and rare disease. We talk about inherited eye conditions, blindness, and if it really is possible to pick a baby's eye color. Naomi answers some of our listeners' submitted questions, and you can submit questions for future guests. Go to our Patreon at patreon.com/allaccessdna. In our first tier, DNA Explorer is $1 a month. It allows you to send questions to our guests. Other tiers include podcast shoutouts, chat boards, and bonus content. Now let's get started. Thank you so much, Naomi, for being on the show today.
Thanks for having me, Kate.
I wanted to talk about your work, and you work in the field of ophthalmologic genetics, which I'm still going to continue to stumble over as we talk, but it focuses on how genes influence the development, function, and diseases of the eyes. So I'm wondering if you can tell us more about the intersection of ophthalmology and genetics.
Yeah, absolutely. The eye is a complex system, and a lot of the complex systems in our bodies, such as the brain, the eye, genes can really impact the functioning of those body systems. So there are lots of genes that can impact the eye. Several years ago, I was on a project where we were looking into a database of different genes called OMIM, and it has thousands of genes and diseases listed, and about 1,200, I think, at our count, had some connection to the eye, which for context was like over 20% of the total genes that were in that database at that time. So that's not to say that those are purely eye conditions or the type of things I see in my clinic, but it means that a lot of genetic conditions and a lot of genes also can impact the eye in some way. And then there are very eye specific conditions where specific genes mainly only impact the eye or even actually specific parts of the eye. So, actually, ophthalmic genetic counselors or ocular genetic counselors like myself, we primarily actually even are subspecialized to talk about the retina, which is the back of the eye. You can't see it with the naked eye, but it's the light sensitive tissue at the back of the eye that an eye doctor and ophthalmologist might be looking at when they look into your eye during an eye exam. That light sensitive tissue at the back of the eye, the retina, is where our photoreceptors, our rod, and our cone cells are. And that's really, really important tissue. And that part of the eye, there are hundreds of genes that can impact the functioning of the retina. And so, actually, accurately, most ocular genetic counselors are retinal specialists in genetics. Actually, we mostly focus on inherited retinal disease, but some of us also work with other conditions that affect the eye, the other parts of the eye, such as the optic nerve, or also syndromes or multisystemic conditions that can also impact the eye and the vision.
It sounds pretty complicated then. So one body part, but a lot of things potentially go into its development and the function of the eye. You mentioned working with like inherited conditions, so kind of a certain subset maybe of genes that play a role in ocular development. What are some examples of eye conditions that can be inherited?
Yeah, so a lot of eye conditions that we have are connected to our genes in some way, but they're not what we would call purely genetic conditions or single gene conditions, Mendelian genetic conditions. So, a lot of what we think about with the eye, the most common things, they are connected to genes, but they're not necessarily purely genetic conditions. Think of something like myopia. I'm wearing glasses because I'm nearsighted. I can't see far away without my glasses. This tends to run in families. Both my parents and my sister also wear glasses for the same reason. But it's not like one gene I can test for can tell me why I need glasses, or we can't figure out precisely which side of the family it was inherited from, things like that, because there's lots of different genes that affect the risk for myopia. Same thing, there's common conditions you might have heard about, such as age-related macular degeneration. As people age, they can have vision problems. And certainly genes and risk factors in our DNA can come into play there, but there's not usually a single gene that could tell us, or a single test that could tell us definitely if someone's going to get age-related macular degeneration, even if it appears to run in their families. So again, it's the inherited retinal disorders especially that are more purely genetic disorders connected to single gene conditions. These are fairly rare conditions affecting about 1 in 3,000 people. But again, there's many different subtypes. The most common inherited retinal disorder, so the most common thing I'll see in an ocular genetics clinic, is a condition called retinitis pigmentosa. We call it RP for short sometimes. This is a condition that is purely genetic. We do not know of non-genetic causes for this condition, and usually it's a single gene, either multiple mutations in a single gene or even a single mutation in a single gene that is causing retinitis pigmentosa in a person or a family. And what this condition is, it's again a retinal condition affecting that light-sensitive tissue at the back of the eye. It primarily affects the rod cones, the rod photoreceptors. So we have in the back of our eye our rods and our cones. Our rods are responsible for our nighttime vision and our side vision. Our cones are responsible for our color vision and our fine detail vision. Our cones are really centered in a center part of our eye called the macula, so they help with kind of our fine details and things like that. A lot of retinal conditions can affect rods and cones, but again, they might affect one more than the other based on the gene. So retinitis pigmentosa is a group of conditions actually, because there's over 80 genes known to cause retinitis pigmentosa. And primarily these genes affect the functioning of the rod cells in the retina. So what happens when the rods don't work is that people cannot see at nighttime or in dim and dark conditions as well. Think about a movie theater or a dark restaurant. A person with retinitis pigmentosa would have a really hard time navigating that space, or they might not be able to see stars in the sky even when other people can. And then they'll also have peripheral or side vision loss that is normally slowly progressive over time. So the condition retinitis pigmentosa is again caused by several different genes, but it's a purely genetic condition. We don't know of environmental or other causes of it. It affects about 1 in 4,000 people, so it's the most common inherited retinal disorder. And it can be variable, but the main symptoms are that night vision loss and progression of side vision loss or peripheral field loss over time. So it's a progressive condition. There's various types. It can start in childhood, teenage years, or young adulthood tends to be the most common age of onset, and then progressing over time to have more visual loss over time.
And eventually, do folks that have retinitis pigmentosa, do they go blind? Like, do they lose their vision altogether, or is it more losing vision in dimly lit areas?
That's a good question. So, blindness is something that I think, or the term completely blind, is something that might mean something to people when they think about what is blindness. I think a lot of folks don't realize that blindness can mean different things for different people. And legal blindness is really a specific term in our society related to things like certain benefits or tax purposes. So complete blindness, not being able to see or perceive light at all, is actually fairly rare among our inherited eye disease population. So most of my patients, even those who would be classified as blind or legally blind, have some form of usable vision. However, that might just be seeing just straight ahead through a pinhole vision, or it could mean being able to tell light versus dark, but not be able to perceive the shapes or specific things in that space. Or it could be, for example, being able to see blurriness in certain areas or to see motion in your visual field, which, is definitely challenging to navigate spaces with vision at those levels. However, it can also be helpful to be able to perceive light or motion. So I think a lot of people, when they think about blindness, don't realize that some blind individuals can see certain things. Some blind people who could be legally blind actually would have some surprising areas of vision. For example, someone with retinitis pigmentosa, over time, their peripheral vision could close in and they could get tunnel vision. some patients have described it as seeing through a paper towel roll, for example, or even through a pinhole. Those people might be able to see an eye chart or do a visual acuity exam at near 20/20, which is typical vision. Maybe they could do 20/30 or even close to 20/20 vision, but they would still be classified as legally blind because most of their visual field is not working. And so the legal blind classification is for things like driving and safety. And you can think about how someone could not safely drive a car if all they can see is through a pinhole, even if it's very clear vision. Whereas other people with center vision loss might have very blurry center vision or blind spots in their center vision. They'll look ahead at a clock and they won't be able to see some of the numbers of the clock. They might not be able to read the eye chart very well. It's very blurry. But in their far sides of their vision, maybe they can see quite clearly, so they can avoid bumping into things, but they would still be legally blind because they couldn't read the eye chart at the levels set by their state, for example.
Okay, that's helpful to understand. You talk some about one example of retinitis pigmentosa and the vision loss. Are there other types of genetic syndromes that involve how the eye develops or vision loss?
Definitely. So there are a lot of, again, genes that impact the eye. And sometimes when we think about the eye, it's not just the vision, it could be the muscles around the eye. For example, there are genetic and non-genetic conditions that impact the eyelid, for example, and whether or not the eyelid droops at all. Eyelid drooping is called ptosis, and that can occur as people age. It can occur due to neurologic conditions. It can also occur due to inherited mitochondrial conditions. There can also be differences in the eye placement when someone is born. And that's not necessarily a problem for vision. Sometimes it doesn't impact vision at all, but depending on the spacing of the different parts of the eye, such as how close together the inner points of the eyes are or the outer points, that can sometimes be linked to other eye conditions, even though that doesn't necessarily cause a vision problem. There can also be eye muscle differences. For example, if the eyes turn a certain way, turn in or out, and whether or not there's weakness in some of the eye muscles that are causing vision problems. Conditions such as strabismus and amblyopia, which historically you may have referred to as something like a lazy eye or cross-eyed. We don't tend to use those terms anymore, but folks might still be familiar with those terms. Those type of eye muscle differences can be very common in children, and sometimes can be connected to an eye condition or a multisystemic condition, or sometimes it can just be an isolated developmental difference of the eye muscles. And then there's, again, all the different parts of the eye. So the eye has lots of different layers going from the outside in. We have our lens, which helps focus the image. We have our cornea, the outermost layer. So all these different parts of the eye can be impacted all the way back to the retina and the optic nerve, which sends a signal to the brain. So all these conditions can be impacted by genes. Again, not always purely genetic conditions, but if they're earlier onset happening in infancy or really early in life, they're probably maybe more likely to potentially be connected to a gene or a syndrome. So if we think about something like both cataracts and glaucoma, I think most of us know someone who might have had one of these conditions. They're fairly common in the general population as we age. So cataracts is a clouding of the lens of the eye. Again, increases with age. That's the biggest risk factor, is aging. It can be very common in our aging population. And then glaucoma is a problem with the optic nerve, actually, and can be linked to higher pressures in the eye and can be linked to other conditions people might have as well, like hypertension, for example. But so again, if you know someone who is 65 years old and has one of these conditions, it's very possible that that could be connected to aging. It could be connected to other environmental factors over their life, such as whether or not they smoked. And certainly genetics might play a role in these, more in a multifactorial way. However, if you know someone who was 1 year old and was diagnosed with this or had congenital cataracts, that's kind of a different scenario. So, early onset cataracts and glaucoma can also be genetic conditions, and they are more likely to be connected to either a syndrome or a multisystemic condition or to a single gene condition if they're happening much earlier than we would expect. So, definitely in infancy and early childhood, but even maybe before about, age 40 or so, we'd kind of wonder why this person is getting an eye condition much earlier than we would expect.
So that may be a sign, oh, this person, because they've developed what may be like a common condition, but they've developed it at a younger age than we would typically think. So that person may need to go in for a genetic evaluation to meet somebody like yourself to kind of see if there is something else going on.
Yeah, absolutely. And there's also, like I mentioned before, age related macular degeneration is another condition that is fairly common in the general population as we age, related to aging and other environmental factors and some genetic risk factors. But when we have someone who is 20 years old and is diagnosed with, quote, age related macular degeneration, that doesn't really add up in our understanding of the age related condition. So,
Mm-hmm.
actually, they might instead have an inherited macular dystrophy condition, which can look similar to the age related condition. And there are some within the eye genetics community common conditions, such as the condition Stargardt disease, which can mimic age related conditions. So, I think definitely that age of onset question is very important when we're looking at genetic conditions. That's not to say there are not people being diagnosed with inherited eye conditions in their 50s, 60s, and beyond, because we're learning they're much more variable than we once
Mm-hmm.
thought, and the age of onset can vary widely. But I think a good rule of thumb is if something is happening earlier than someone might expect the presentation of a common condition, definitely a good reason to ask if genetics could be at play. Likewise, even though many conditions do seem to run in families or somewhat run in families, certainly a strong family history is worth bringing up a question of whether or not genetics could be in play, especially if there's a certain pattern like seeming to run one generation after the next from one side of the family or only affecting males, for example. Things like that are good things to look out for in your family history of eye conditions.
Well, and that's helpful to know. I think it's, seeing those signs or maybe needing to ask more questions. But I know that ocular genetics is still being researched. There are still things that we're learning about. Like you said, there's quite a few genes kind of at play that we have to better understand. So, what is being done right now in terms of research for these genetic eye conditions, and what's available for folks that may want to participate in research?
So the research is kind of in a couple different arms. One is diagnostics. So the first thing we're doing in genetics is trying to diagnose the condition or find out whether or not there's a genetic cause. And like I said earlier, there's some inherited eye conditions that are thought to be purely genetic. We think that genes are the cause of them and that we're expecting to find a single gene cause for patients with conditions like retinitis pigmentosa, for example. That said, when we do our standard of care testing, which right now is starting with a panel test of hundreds of genes, the panels tend to range from 100 plus to over 350 genes, but it's a few hundred genes normally is what we're looking at standard of care as a first line screen for these patients. And our diagnostic rate is about 60 to 80%. And that means that 30 to 40% or 20 to 40% of people, depending on the diagnosis, are not getting an answer, even though we were going in thinking that they definitely have a genetic condition. So that means we are missing part of the solution. It doesn't, when we get back a negative or inconclusive genetic result for certain conditions like retinitis pigmentosa, we're not telling the patient, oh, your condition's probably not genetic.
Hmm.
Instead, we're telling them, we still think you have a genetic eye condition. We just didn't find the answer with our current testing and technology. So, a lot of the research in the field is thinking about the what next, going beyond that panel of genes to look at 20,000 plus genes, such as in an exome. Or actually, more commonly, what we're starting to do is look at the genome. So, our entire exome of 20,000 plus genes, plus intronic regions or regulatory regions of genes, because what we're finding is we think a lot of the missing cause of inherited retinal conditions especially seems like it might be in more complex regions of our genomes, such as the intronic regions or perhaps structural variations, parts of our genome that are tricky to test for in traditional testing methodology.
Okay.
So that might explain why we're missing some things. And so an active area of research is trying to find the missing cause of disease. And so there are research studies patients can enroll in to do broader testing as we try to find the underlying genetic cause. So that's one big area of research, and something that patients with negative or uncertain genetic testing in the clinical space might then go on to do additional testing, either clinically or through a research study, to try to help us understand additional causes of disease or find their genetic solution. And then for folks who either have a genetic solution or don't, but who have a diagnosis of an eye condition, as you can imagine, a lot of people, when we give them a diagnosis, they want to know what's next. What does this mean for me? Both in terms of potential progression or family history implications. And those are things we answer in a genetic counseling session when we're giving back results. But then a lot of people also want to know, is there anything I can do about this? Is there a cure? Is there a treatment? As you might recall, a lot of these eye conditions they onset not necessarily from birth, and they can be progressive over time. So we have a lot of patients, not all, but a lot of the inherited eye conditions, especially the retinal conditions, they can have an onset in someone's teenage to young adulthood to even mid-adulthood years, and then have slow progression of vision loss. And so that can be a pretty jarring effect on quality of life, and people can over time lose ability to independently do certain tasks such as drive a car. So a lot of our patients, not all, but a lot of them, are coming to see us because they want to know if there's a treatment for what's going on, or a way to stop the progression,
Right.
slow the progression, or potentially even reverse it. Unfortunately, for the most part, these conditions do not currently have treatment available, which it reflects a lot of what is happening in general in the rare genetic disease space. However, also consistent with what we're seeing across rare diseases, in the past 5 to 10 years, there have been an explosion of research related to gene-based therapies, such as gene therapy.
Mm-hmm.
In fact, the first ever approved gene therapy in the US for an inherited condition was for an inherited retinal condition. And so the eye is actually scientifically a good body system target for gene-based treatment because we have two eyes. So for any scientists in the room, that's a great experimental setup, having two eyes, like a control eye and a treatment eye, for example. Of course, if a therapy works, the goal would be to treat both eyes if they're both affected. But we have two eyes, so it's great for a research model. The eye is accessible. For example, the brain is not accessible to an injection or something. It's much harder to access. But the eye, some treatments or some things in the eye can be even an injection in an outpatient setting sometimes. Or the other thing is the eye has its own form of kind of an immune barrier, such as folks might have heard of the blood-brain barrier. There's kind of an eye barrier for immune conditions as well. So, hopefully for treating the eye, it's not going to have multisystemic impacts. And again, while there are syndromes or multisystemic conditions that affect the eye, a lot of our inherited eye conditions are only affecting the eye or the vision. So we don't necessarily need to find a treatment that can affect the whole body. So there's lots of research into gene-based eye treatments, gene therapies where we're adding back a healthy copy of the gene, also looking into gene editing therapies, RNA therapeutics as well. There's currently just one FDA-approved therapy in the ocular space. However, there are tens of other clinical trials in the space. So a lot of my patients are also interested to know, does their gene or does their condition have an applicable clinical trial to participate in? And sometimes the answer is yes. These things are still in development, and clinical trials can take several years to see if they're safe and effective, but there is a lot of research into gene-based therapies for the eye conditions.
It sounds like there's a lot of potential. We're just not there yet, but there's still a lot of work being done currently and trying to figure it out. And I like that you added in why the eyes may make a good case to kind of do some of these studies to learn more about that and how to impact with like gene therapy types of treatment. We did have some listeners submit some questions. So for folks that are interested in doing it, you can do it at our Patreon, All Access DNA. And I wanted to talk to you about some of these questions because I think there's some of the more popular ones, especially I know when I talk about genetics and people want to ask me questions about genetics. There are always a lot that seems to come up with eye color and vision. One of the big ones I think that we hear about is eye color. And people will talk about like, at some point, would you be able to choose your baby's eye color? So why don't you tell us a bit how eye color is inherited? Because with that many genes involved, it sounds like it's probably complicated.
Yep. So eye color is a complex trait. It's not one of these single gene conditions. I use the conditions word in quote because eye color is just normal variation for the most part, but it's a complex trait influenced by several different genetic factors. It is inherited. So your biological parents, eye color does influence the eye color you will have, and your eye color would influence the eye color or potential eye colors of your biological children. That said, it is not a simple, one gene kind of recessive dominant type of inheritance. I think really at a simplistic level, maybe in elementary school, folks might have heard that brown and blue eyes kind of follow some degree of dominant and recessive, with brown being more dominant over blue eyes, which to some degree does reflect what is happening. It's just, as we know, not as simple of everyone in the world either having blue or brown eyes. There's variations within both those colorations of eye color, your iris color. So while it is true that generally a trait such as blue eyes tends to be inherited in somewhat more of a recessive manner than brown eyes, which tends to be a little more dominant. It's not quite that simple. It's not simple Punnett squares that we can do for eye color. And there's many genes that can influence the eye color. And as parents might know, that the eye color that a baby is born with can change in that early year of life. So eye color also changes a bit. It's not something that necessarily changes drastically over our whole lifetimes, but in the early lifetime, eye color does change a bit as well.
That's so interesting too, having had kids that had one eye color when they were born, and now I have one that's very different as they've been getting older. Is there a connection between eye color and vision quality? Because I feel like I've heard some people mention that before, but I don't know if that's really true.
For the most part, no. Just as, for the most part, the color of our iris or the colored part of our eye is not necessarily a genetic, quote, condition. Again, there are occasional genetic conditions that impact eye color, such as people having heterochromia or two different eye colors. So similarly, while for the most part, me having hazel eyes and someone else having green eyes or blue eyes is not going to determine which of us has a stronger glasses prescription or would need glasses. On average, no, that does not determine our visual function, because again, the visual function is normally coming from the back of the eye for the most part, our retina, our optic nerve, not the iris, which is what we can see visibly on other people's eyes. That said, there are certain conditions that can also impact eye coloration and vision. So that the one that comes to mind most strongly would be different albinism conditions, like oculocutaneous albinism, which are a group of conditions that affect the pigmentation in the hair, skin, and eyes, where some folks have no pigment in their eyes or irises. And so having a condition like that drastically impacts the eye coloration due to an underlying genetic difference, that can impact the eye. People with different forms of albinism usually do have lower visual acuity, and then they also can have some additional visual concerns and can also be quite sensitive to light as well. So there are certain eye conditions that can impact vision. If someone has a problem with their pupil, for example, which is that dark space that lets in the amount of light. That could also impact sensitivity to light. But for the most part, what we're visually seeing on someone's eye is not representative of the eye functioning or the vision.
And then I think this question you answered a little bit, but thought it would be good to kind of to hit again is if both parents have vision problems, does that make their child more likely to inherit those vision problems?
It depends what the vision problems are. Again, a lot of eye and vision problems in the general population are multifactorial conditions, combination of our genes, our environment. And so things like needing glasses.
Hmm.
Myopia does run in families, needing to wear glasses to see far away, for example, like I said for myself. So that does have a genetic component. So the fact that both of my parents have myopia and wear glasses definitely made it more likely that that would be the case for me and my sister.
But it doesn't mean that somebody would have a
It's not
child.
always straightforward, yes, and it's also we don't always know exactly, maybe one of your parents has glasses for farsightedness.
Right.
Having trouble reading close up, or maybe in the family tree or the pedigree, somebody has cataracts, somebody has glaucoma, somebody has myopia, so it kind of depends on the pattern. There's also things like retinal detachments that can happen, and that can happen due to genetic conditions such as multisystemic connective tissue disorder, Stickler syndrome, which can be dominant running in families or can also have recessive forms. Or it can happen because people in the family have really high myopia that also may have a genetic component, or it can be related to somebody having an injury or getting hit in the head. So, understanding the reason for somebody's vision condition in the family. And this is a good piece of advice for all genetic conditions or all health conditions. As we gather our family history information, it's great if we have access to those people and that information. We don't all do, but if you do, learning what folks have or what health conditions or eye conditions they have, and also trying to ask that follow-up question if we know why it had happened or when it started, because that might give us a clue to whether it's connected to genetics or was an injury or something more sporadic that occurred.
For the people listening today, and I appreciate you answering some of the listener submitted questions, but if there's one thing you want them to remember or take away related to ocular genetics, what do you think would be the most helpful thing for them to remember?
The most helpful thing I think we talked about is just being aware that blindness or vision loss in general is not a homogenous thing. So, if you see someone who might be visually impaired or blind, for example, someone navigating the world with a white cane or a guide dog, you can't necessarily assume what level of vision they have or why they might have that vision impairment. So I think that's important. I think a lot of folks maybe think that blindness is just one thing, not being able to see at all, but there's different levels of vision loss and vision impairment, and legal blindness even can mean different things depending on which part of the vision is impacted. And I think then if we go more broadly than that, I would just encourage everyone to be aware of folks in their surroundings. There might be people in your surroundings. Again, some of these retinal conditions or inherited things I see are fairly rare, 1 in 3,000. But when you take it all together, there's a large portion of the population, especially as we age, that might have some degree of vision loss or vision impairment. So just be aware that there could be people in your workplace, your community, walking around who might not be able to see typically, and being understanding of folks who have, for example, a white cane or a guide dog, and being a helpful human and just not treating people oddly if you notice that. But as you might expect anyone who might need help crossing the street, you can offer your assistance. You can ask if people need something in a curious and helpful way without probing for details. So just be aware that even though inherited eye conditions are fairly rare, in general, having eye differences or some degree of non-typical vision is quite common across the general population, and you're definitely going to meet people in your workplace, your lifetime, who have eye conditions, and being aware that not everyone can see the same, not everyone can read clearly, see colors. Some people might need different accessibility tools in different settings. So just being aware of that when you're giving a presentation, when you're out in a crowded space, things like that.
I think that is an excellent point to end on, and to think about just being understanding and aware that folks in many ways are not going to see the world the way that you do. And there's many reasons. And so I think that's a great take home, is just being more understanding. So I appreciate it. Thank you, Naomi, so much. I learned a lot, because ocular is not a space that I have any familiarity with at all. So just appreciate you going through everything.
Of course. Thanks for having me today.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.